Good afternoon to everyone. Thank you for joining us today and welcome back to Endymed's webinars. Today we're having a special session. We're being honored to introduce Dr. Jade from Malaysia and Dr. Atinuch from Thailand. They're both gonna speak and present their experience and and protocols with Endymed. Thanks, Doctor, for joining us. And we will start today with Dr. Jade. He has a lot of experience and for several years working with Endymed and working in the aesthetic field. Rather than radiofrequency devices, he has a lot of experience with lasers, injectables, stem cells, a lot of special indications that he's treating in his clinic, like hair regeneration and all of other interesting indications that he will speak about today in his session. So, Doctor, thank you for joining us today. Thank you for your participation and presentations. And please, Dr. Jade, the floor is yours.
Okay, so let me share my slide. Okay, everyone can see and hear me?
Yes.
Okay. So let me start. In the modern world, we have countless amount of apps that makes us look slimmer after having flawless skin. In fact, most phone cameras are already built to do that for you nowadays. So I think 90% of us are guilty of that. But today, let's discover a technology, the Endymed, to give us beautiful selfies without filters. I'm Dr. Jed from Malaysia. I'm the medical director for Pure Touch Clinic. I have a Chinese nickname as well, Dr. Zhen Bu Tong. This was given to me by my patients. In Chinese, it means doctor who injects without pain. Apparently, I have painless hands. That's what they say, but that's me. So this is my content for today. I have over just 60 slides, 30 minutes. I'll be covering on these 5 topics. So some of these topics are very basic. But it's a good mixture of content. The intro of Endymed is for those that has not or is looking for an RF machine. There's also information for advanced users where I'll be sharing some of my own technique at the end. So let's start. Aging is inevitable. Okay, we can't run away for it. We will definitely look different at 30, 40, and 50. I like to use this. If we look deeper why we age, I usually like to use this picture with the house methodology to explain how aging works. Of course, first you have the facial structure, which is by the bone. Okay, so this is the deepest. As we age, the bone gets resorbed and the orbit of the eye gets bigger. So when that happens, there's less support. So for easy understanding is like the construction of a house, base and the pillars of a house. Next, we come to the fat pads on the face. So as we age, the fat pads get smaller, and in between, it starts to have all these volume losses and spaces in between. So this is what I call the walls of the house. The next part, which is the most important part for today, is the skin quality and elasticity. So of course, as we age, our skin loses its elasticity and there'll be more sagging. So this is equivalent to the paint job of the house. So if we can practice aesthetics following this way of rejuvenating at every level, you get fantastic results. But today we'll be focusing more on skin. I would like the audience to kindly refrain from taking pictures. I've got consent from some of these patients to show pictures, but not to take their pictures. This is a patient of mine. In fact, this is one of my friend's mother. She's 67-year-old, and she did do the rejuvenation at all levels, from the bone to the fat pads to the skin. So she definitely looks 10 years younger. And if you look carefully, you can see the eyebrows has raised, the lateral canthus has increased, the under eye bags has decreased. It's still there, it's not 100%. The nasolabial fold is less, the marionette line is less. And if you look at the curvature of the outline of the face, it's sagging and it droops like ice cream. So if done at all levels, you get great results. So I hope I've caught the attention of everyone to understand that it's not just one modality, but the Endymed that plays a big role with the skin has a very important part in this. So collagen. Okay, collagen is the biggest topic for me in 2024 because everything is about collagen amino acids. It makes up to a big portion of our skin. And by the age of 25, it drops 1% every year. So that means your skin will start to lose its elasticity and sagging will follow. So we will talk about collagen quite a bit in this whole slide. So to understand better, I would like to bring up everyone's attention to this. Amino acids are the building blocks for peptides. Peptides are the building blocks for proteins, and collagen is a type of protein. Okay, so we'll talk more about this later on. So the introduction to radio frequency. Okay, so when your skin starts to form wrinkles and laxity of skin, it's mainly caused by the loss of collagen function. And heating the dermis to 52 to 55 degrees Celsius was found to have new collagen fibers and collagen remodeling. But on the epidermis is different. From 40 to 42 degrees Celsius on the epidermis, this will indicate that we reach the desired temperature in the dermis, which is 52, 55. So on the top of the epidermis, you are not aiming for anything higher than 42. You're aiming for 40 to 42. But what a good radio frequency machine can do is to bring up the level deeper. Okay, so this is how it works. So when radio frequency is when RF is applied to the skin, it heats up the skin. So the first immediate effect you will see is collagen contraction. Okay, we see that a lot, quite instantaneous. Then there will be a long-term effect because there will be repair and collagen remodeling. So when you add both of them together, over time, you get good skin tightening and wrinkle reduction. So we do have other energy-based devices such as laser and say IPL that successfully use in hair removal, treatment of pigmentation. However, they have a very mild effect on tightening of the skin. So we can't really use that to tighten the skin. But radio frequency is different. It penetrates the skin a lot more deeper to be effective, and it's colorblind. So if it's colorblind, it's very useful, especially from the country I'm in. I'm from Malaysia. We have many multinational races with different skin types, especially from skin type 3 to type 5. So this is very useful in where I'm from, and I'm sure it's all over the world as well, because even if you're not a multinational country, you have lots of tourists and a lot of people from around the world working in those cities. So it's a shift. There is a trend now where there's a shift away from plastic surgery, liposuctions, and other invasive surgeries. So these are some of all the energy-based devices that is on an increasing trend. And definitely, radio frequency is in this category. So to those that is thinking about getting a RF device or already has a RF device, let me introduce to you a true professional product line, the Endymed. The Endymed is running on a patented, FDA-approved 3 deep technology running at 1 megahertz, which is equivalent of 1,000 kilohertz. So we have the Endymed Pro, of course. So this is what I'm using in my clinic, and we have Endymed Pure 2.0. Okay, but there is a total of 7 handpieces which we are using. Over here, you can see there's 8. Actually, the handpiece called large has been discontinued because it has been superseded by this handpiece, which is called the contour with the shaper, does pretty much everything already. That's why it has been discontinued for the large handpiece. So what's the difference between both of them? They're both good. Of course, since I have the Pro, I will say better things about the Pro because I'm more well-versed with it. So the Pro has a higher power, okay, compared to the Pure 2.0. For the handpieces, there are 7 handpieces for the Pro and 6 for the Pure 2.0. So the additional handpiece for Pro is the contour head. So I'll tell you a little more about the contour head later. And the Pro intensive RF microneedling can go up to 5 mm compared to Pure 2.0, which is 3.5 mm. For 2 other handpieces, which is the FSR, the fractional surface resurfacing handpiece, and the intensive microneedling RF handpiece, in the Pro, we can control 2 extra things more, the power and the pulse width. In comparison to Pure 2.0, you can't control that. You just have 6 levels to play with. Okay, so these are the differences. So what am I talking about all this while? The patented Endymed 3D technology. To understand a little better, we will talk about the more common RFs out there. So we have the bipolar RF, which are electrodes side by side. So for these bipolar RF, they are relatively superficial. And of course, if it's too superficial and not deep enough, it's less efficient. And with the monopolar RF, nothing wrong with it. It means you have an electron on top and you have the grounding pad below where the energy is going towards that direction. So with this, it can be quite strong as well, but it requires intense cooling because the epidermis may heat up and become painful. Now with the 3D technology, this is a smaller animation where the electrodes are side by side, but one electrode forces the other electrode with a different polarity to go deeper in. So it can deliver definitely deeper and stronger energy without having the risk of burning the epidermis. I'm going to show you a little animation on how it works. So you can see how the first polarity forms, and then the second one forms after this, which is the first one pushes the second one lower. Then you have the third one, which pushes it even lower. This is the 3D technology. So this animation is easier to understand compared to me explaining. So next is the thermal profile comparison. From here, you can see the bipolar on the left and 3D technology on the right. With this thermal comparison, both are having the same power, but 3D technology can go 3 times deeper. Okay, 1.5 compared to 6 mm. So this is the 7 handpieces I was talking about. We've grouped them into 4 types for simplicity. So this is the focus RF, where we can use on the body, we can use on the face, just pure RF, okay? Which The first one is the smallest one, which is eye fine. So eye fine is used for periorbital and perioral areas. It's the most gentle handpiece you can find. The next is the small handpiece, which is used for the face, the neck, and the décolleté area. So it's deeper than eye fine, but it's not deep enough to go into the body. That's why it's focused on these areas. The next one is the mini shaper, which is actually one of my favorites, actually. I've used this for most of the things. So the mini shaper goes deeper than the small one. So in protocol from Endymed, it's focused mainly on the jawline, double chin area, and hard to get to areas such as your elbow and your knees and your arms. Okay, so the next one is the shaper. So this is a very powerful headpiece which is kept for the body, for the butt, for the abdomen, for the flanks, for the buttocks and thighs. So these are the 4 handpieces on top. The other 3 handpieces, this is the 3 most iconic handpieces for the Endymed, and they're truly the most amazing handpieces which distinguishes them from a lot of other radio frequencies. So the first is the intensive, which is the RF microneedling. The second is the FSR, which is for fractional skin resurfacing. And the last is the contour handpiece, which has vacuum-assisted technology that helps even with stretch marks and cellulites. So then we have these 7 handpieces where we actually can compare where the FSR's depth compared all the way to contours depth, how far it can penetrate is a big difference. So the FSR, we know it's fractional, it has to be very superficial. And the contour being the deepest because it has a vacuum-assisted handpiece that can suck the fats in to make the RF penetrate even deeper. Now, of course, you have the eye fine, the small, the intensive RF microneedling, the mini shaper, and the shaper. This is just a brief description of how far, how deep it can go. In fact, the mini shaper, the shaper, and the contour head is one that can reach down to the subcutaneous fats. So with these 7 heads, there are so many indications that Endymed can treat from the head to toes. Basically, anywhere there is skin, you can treat it. So from the skin to reducing fats and reducing cellulite, the Endymed is very versatile and comprehensive at the same time. So there's no doubt that this is a very good machine to start off with in a new clinic setting. Okay, if you have not bought any machine yet, this should be one of your primary machines because it can do so many things. So for me, because it can do so many things, you end up saving quite a lot instead of buying so many other machines to make one of the Endymed. But for me, my clinic has been around for almost 9 years. I've got quite a lot of machines already. So I added the Endymed because it has to offer more advanced treatments for combinations like in my clinic. So I'm not going to read all of these to you because I'm sure everyone has already read so many things the machine can do. So with the 3D technology, we know that it's safer because it can go deep at the same time. You don't need intense cooling for the epidermis. But on top of that, you have other safety features such as the motion center, which the pulse is emitted only if the handpiece is in motion. So for example, if your therapist or a doctor all of a sudden starts to slag off and stop, or maybe talks to some person and stops moving their hand, it's not going to burn the skin because it just stops. And the tissue contact sensor, this for me is the most important because if the pulse is emitted only if the handpiece is in full contact with the skin. So there's a lot of time, there's a lot of curves on the body and face that sometimes the handpiece will not have full contact. When there's no full contact, it pops out a warning and it stops. So you have to make sure it's parallel to your skin. And this is the real-time impedance measurement to fine-tune the treatment parameters according to skin properties. So adjust accordingly to how the skin is. Fantastic, even safer. So I'm going to talk about the three most iconic hand pieces, which is the intensive, the FSR, and contour, because there's more things to talk about and they're cooler. Okay, so the intensive handpiece, this one you're looking at, it can treat many things. So it can treat wrinkles, pores, scars, stretch marks, and deeper things. So how is it different? If you can see, there are other RF microneedling out there, which is also non-insulated because Endymed's intensive is non-insulated, but it does not have the FPM, which is fractional pulse mode. The Endymed has the FPM for uniform heat distribution and a wider coagulation of column around the needles, reducing the risk of overheating. So instead of one continuous pulse, it has multiple pulses. Okay, and other type of needles are insulated needles where it's just at the tip. So the one on your far most right is the intensive microneedling, where it can go as deep as 5 millimeters. That is deep compared to other RF microneedling. And combine the fractional pulse mode, it can go at higher energies with a safer safety profile. So you can see on this screen how the thermal screen, actually, the intensive works in the thermal screen, very uniform. So that was by the Endymed 1.5 mm. So now this is, and the video ends. Yes, it's only 1.5 mm. So because of the FPM mode, the downtime is considerably much less. So in my experience, my patients, when they get the intensive, they have a downtime of maybe 1 or 2 days. And by the third day, you visibly can't see much anymore. But of course, when they wash their face, they still feel it's a bit sensitive, a little raw, but that's on feeling it. But visibly, by the third day, you can't see much already. So this is the histology of what happens when there's when we use the intensive handpiece. You can see how this is at 1.5 mm, 2.5 mm, and 3.5 mm. So what I want everyone to notice is the area around it, how it goes really beyond. It's not just 1.5 mm, it goes deeper beyond that. Okay, so that's a great thing. It's a wider area effect. So this is me in my clinic doing it. So I got it off our social media. So just very brief, simple videos, how the intensive is done. Okay, so I'll mute the music. So the next most iconic, second most iconic handpiece is the FSR, which is your fractionated surface resurfacing handpiece. So this causes microablation at the epidermis, but volumetric heating, which goes through to the dermis. So it can go up to 2.5 millimeter because of the volumetric heating. It's pretty much the whole depth of your skin. So with this smooth scan technology, we are explain a little bit more. It has minimal downtime and reduced risk of PIH, even for darker skin tones, because it's colorblind actually. So when I say minimal downtime, I actually really comparing to fractionated CO2 laser, where the downtime can be as long as 2 to 3 weeks. But with the Endymed FSR, the downtime is just 5 days. So you can see how the animation, how it works. I'm going to show you now how it really does work with another animation. So you can see there's 14 columns of electrodes. So how does it work? So the first electrode will go off first, then 5 other electrodes in the opposite polarity will blaze off, and keeps going on and going on. So this is the scanning process where it can go up to 2.5 mm. So with this, that causes ablation, which is what we want, very superficial ablation to take away a portion of the skin to let repair, remodulate, and volumetric heating going into the dermis. That's a thermal scan as well to see how it works. You can see right after it's done, the heat is still there. So the heat will stay with the patient for some time to create the control damage it needs so that it goes through the next repair and remodulation phase. As you can see, the comparison, FSR being the top row and another competition being the second row, you can see how much deeper it's there and how much more consistent it is across the whole probe and how the heat stays on after, even after 10 seconds. So this is another test which the Endymed has done. So consistency is really the key for all successful treatments in general. The FSR has, so both experiments, they do it on gelatin and they see how much gelatin has melted away. So if you can see the FSR, it's very consistent. You know, everything has been melted almost the same compared to, of course, other competitors where, you know, in the middle and outside is different. Here's a short video of me doing the FSR for one of my patients in my clinic. So throughout the whole phase, we usually shoot 150 shots. So the FSR handpiece is a consumable. It has 450 shots, so you can use it for 3 sessions for one patient. Sharing is not encouraged. Okay, enough of this video. So these are what type of results I can get for acne scarring patients. You can see that a lot of the scars have healed. There's a mixture of rolling scar, box scars, and ice pick scars here. So I use 2 different ways, intensive and FSR alternatively. Okay, intensive first, then FSR, then next is intensive. So total of 3 sessions each, but in alternating. So all these patients I'm going to show you now has a total session of 6 sessions, 3 each. I would say that FSR is much better at box scars, and the intensive RF microneedling is much better at ice pick scars and rolling scars. At all angles, even places to begin with not much scars, it has improved the skin quality. This is another patient of mine who has done the same thing, left side, right side. So consistency is really the key here. Okay, coming to the last iconic, amazing handpiece from Endymed, it's the contour. So what is this about? You can see in the video that and the picture, there's a small hole in the middle. So with vacuum, it sucks the fats in and the RF starts to work on it. So when it sucks the fat in, just like your fat freezing, sucks the fat in first, you get a deeper penetration. So when it's being done, it helps with fats, of course, it burns off fats, helps with cellulite, lymphatic drainage as well. This is a video
Fat reduction,
of it.
skin tightening,
So some animation
cellulite improvement.
of course the videos.
Introducing Endymed Contour, hybrid 3DV technology combining heat and pulsed vacuum to provide exceptional aesthetic results. The Contour is designed to be user-friendly and enables customized treatments to target hard-to-reach skin layers effectively. The Endymed Contour treatment uses patented RF technology to heat deeper layers of the skin where irregular fat cells and collagen fibers coexist. The treatment is even more effective with pulsed vacuum massaging, which reduces subdermal and adipose tissue to increase the affected treatment area. This combination of heat and pulsed vacuum stimulates production of new collagen fibers, tightens existing collagen, improves blood supply and circulation, and boosts the lymphatic system. The Endymed Contour treatment can significantly improve cellular.
I'm not sure if anyone heard that part. I think the video had a slight glitch in the sound. So this is us doing in my clinic using contour handpiece. It's the only handpiece where it has a thermometer.
40 to 42.
So we need to target 40 to 42 degrees Celsius, and this is the most convenient, having the thermometer on the handpiece. There's also another part of it which controls how strong the vacuum. This is quite important because some people are severe obese, light obese, and some not obese, but they also want to lose their fat. So you don't turn the vacuum strong for everyone, depending on their size. This is one of my patients. I can share you her results. So this is just using the contour head. We did it for the front abdomen and the flanks. Okay, so a total of 8 sessions, and she came in once every 1 to 2 weeks. Sometimes they don't come on time. That's the realistic world. So it took around 2 to 3 months to complete this. You can see how she's wearing the same bottom. We call this a sarong, okay, in Malaysia, okay. It's the same tightness, everything's the same, and the belly is overhanging on it. So after the whole 8 sessions, it's not hanging anymore. If you look from the sides, it's overhanging, and now it's cutting in instead of curving out. No liposuction, nothing, just using the contour headpiece. So all these things which I've talked about is all backed up by publications, multiple publications. So I will not fakely quote anything if there were no publications on it. I'll try to read as much. I have not finished reading because there's so many. Please read in your free time because under time constraints, I can't. This is another patient. I would love to share a story of hers. So the husband has a problem with her belly because the husband always realizes after birth, every time the wife sits down, the belly is touching the thighs. Okay, so meaning it's loose. So she came over and she did 1 session on shaper. It's not even the contour because you can see she's not so obese to begin with. The main thing is the laxity of the skin. She just did 1 session using the shaper handpiece, and it tightened up very fast. And this is a picture taken after 1 month. And it was the husband that realized again that she has results and her belly is not touching her thighs anymore. So this is another shot doing the mini shaper. It's not like raven head, it's just face and neck and jawline. So that was the standard protocol where I'm doing the jawline. This is standard. The next fun part is next, where I show you the non-standardized my own. So this is my own protocol. The standard mini shaper and small protocol is depicted over here, where the mini shaper is supposed to be treated for the jawline, submental, arms, and knees. The small one is treated for the cheeks, neck, submental, and decollete. For me, I like to use the mini shaper more. So unless the patient is very scrawny, very thin, just loose skin, I will use this. But most patients that come into you, they're a little thicker, a little more chubby, they want a V shape, and you can just do a pinch test. The fats are there. Okay. So for somebody like me, I probably need just small. But I have a lot of patients that come in, they want to achieve the V shape, they want to look slimmer, they want to look like they lost weight. I just go to the mini shaper straight. And I don't do it the conventional way. So I combine the face and jawline in one. Very common. I mean, how are you going to choose which patient gets the jawline, which patient gets the face? They are attached together, they are one. So usually when I attack both of them together, you get fantastic results. So what I do is I start from the face, okay? And when it comes down here, I do the C, coming back twice, then I go back here and start over again. And I keep repeating this for 12 to 15 sessions, not sessions, sorry, 12 to 15 passes per session. I can get results very fast. I also, you see how this line came up? There's also a problem here because some people have very defined angle of the mandible. So when they have a very defined angle of the mandible, it's hard to do this shape, C-shaped thing, because sometimes when it goes through the bone and it's not flat, it can kind of stop the machine and cause a bit of discomfort for the patient. So for these type of patients who are very cachexic, very strong angle of the mandible, I usually like to break it into two, where I'll do this part first, come back down, then I'll do the other part, and go back up. So I break it into two parts. Okay, this is my small sharing how we can improve. And this is how it's being done, where I do the face and jawline together. So this, we're doing the face first. And we attack the jawline together. Then we go back to the face and repeat everything over and over again. This is me again. Sometimes we can't take the video right in front of our patient's face because we have to hide their identity. This way, no one knows who they are. And these are the results I get. I'm sure most of you can get similar results or even better than mine. But I do want to share, when you attack the face and jawline, it's immediate. So what I usually do is I do one side first, take a picture, show it to them, give them a mirror, let them see how amazing the results is, then I do the other side. So I have done this side first, so you can see how it slimmed down the face almost immediately. Take a picture, let her look at it, appreciate the face, appreciate the results before I did the second side. Same for these two patients. These two are different patients. I usually attack one side first. Let them see the mirror so you can see how the cheeks on the done side, it's lifted. Compared to the other side, not done yet, the cheeks are still facing down. Okay, for both patients. Okay, so this is another part where I share a little bit about a technique. So the eye fine is used for periorbital and perioral areas, and the FSR can be used anywhere, to be honest, anywhere the skin. Okay, because the fractional surface resurfacing can do the same for every single part of the body of skin. So what I usually like to do is combine both of these for delicate areas with fast results. So I would usually do the eye fine first, complete 12 passes, then only we do the FSR under numbing cream. I don't usually do the intensive around the eyebrow and below the eyebrow area because it's quite painful because of the bony area. So I usually combine these two and it gives me a really good results because the FSR can really penetrate 2.5 mm. So for me, that's deep enough for these very delicate areas. So there's also another problem where for some skinny patients, they have very prominent orbital ridge here, which can be quite uncomfortable when you go over it. Okay, so sometimes with some patients, when you start to feel discomfort, you can actually break it out into 2 parts. So instead of doing 12 passes continuously, I do half first, 6 passes, then do the other side 6 passes. So this is me doing the eye fine. Okay, on the other side as well. The key to making the patient feel more comfortable is not about how fast you do it, because the machine actually detects how fast you're doing it. So there's real-time impedance. So if you're doing fast, it needs this amount of energy. If you do it slow, it needs this amount of energy. The key is doing it very parallel to the skin, okay? And making sure there's full contact. Because when there's no full contact, it causes some discomfort and the machine will automatically stop. Then you have to press continue. And always make sure there's adequate gel underneath. That's why every pass is 30 seconds. It's designed for that way. So for me, after every 1 or 2 passes, I'll make sure there's adequate gel again underneath the handpiece and doing it. So instead of just continuously do it, you may cause a bit of discomfort. These are the results for just eye fine alone. So I love to do monotherapy, just trying to prove that the treatment works. If I could suppose to combine with everything in the world, then when you finally have results, you don't really know where the results are. So why I take this picture, because I can tell you the eye fine works alone, even without an FSR. But if you were to combine both, then maybe you cut short the time for results. Instead of a few months, you get it in half the time. So she had 6 sessions of eye fine. She came in quite on time, 1 week apart, and the 5th and 6th session, 2 weeks apart. So I didn't photo edit. I don't have an apps to photo edit all these kind of pictures. You can see the eyebrow is slightly lifted. The eyelids are lifted. If you look carefully in the before picture, you see these fine wrinkles that's on the lateral canters going all the way down to under her eye bags. So what do we see? We see eyebrow lift, eyelid lift, less fine wrinkles. The bulge underneath is also less because when the skin tightens, it keeps the bulge in. And this is how she looks like from the front. So you choose which one is selfie with filters and which one is without filter. So the after one looks like there's filter, but there's no filter, okay? This is another advanced protocol. I didn't invent this. I also followed some good doctors with good experience. This is a quick tap protocol. So the conventional way is to have maybe 10 passes to 12 passes, depending on which handpiece you use. So for this, in the realistic world, it's quite useful because not everyone has the time to come to your clinic every single week. Okay, so and some people want quick results because they got an event coming up. So in just 3 treatment sessions, you have to spend longer time with your patient. So instead of like 20 minutes, you have to spend double or more than double the time of minutes. You need to use a higher energy with more passes, suitable for very busy men and women. Okay, so what we do is we do step 1, 20 passes on one side first. Then we go on to the other side while the other side is cooling off another 20 passes. So we take turns, we alternate the sides. As it's cooling down, then we go back to do another 10 passes, 10 passes, 10 passes, 10 passes. So total of a lot of passes. Please charge your patients more when you do this. Okay, coming close to the end of my slides, where I'll be sharing something, of course, with Endymed and how we can combine with Endymed. So of course, post-procedure lifestyle changes, I can't stress how important is this. Okay, to provide the building blocks and catalysts for repair and modulation, the patient has to eat well. You'd be surprised. Some patients don't eat. They drink every single day. Dinner is beer. So there's no protein in that. There are some vegetarians as well. So vegetarians has a lower source of protein. That's why there are, with energy-based device in general, not just Endymed, there are some patients who pay a big amount of money to you. Some get results, some minimal results. And when you finally ask them, how's their diet and how's their nutrition intake, some of them, they don't eat meat. So how you don't give amino acids, remember collagen, the building blocks for collagen is amino acids, through the repair and modulation stage, if you don't provide the building blocks, your results are not going to be as good. So please stay away from sunlight as well, because while the skin after the Endymed is repairing and modulating, you wouldn't want the sunlight go out there, bask for a few hours. Something Asians and Caucasians will never understand each other. One staying underneath, hidden, one's exposed to the sunlight. But in general, please stay away from sunlight after the treatment, because you wouldn't want the sunlight to hinder the repair and modulation stage after the Endymed. Adequate sleep as well. Just remember, this is Sleeping Beauty behind here. Sleep is very important for repair. Okay, you need 8 hours of sleep if you have enough time. If not, 6 hours is good enough, but try to aim for 8. Sleep in the right posture as well, because see how Sleeping Beauty is sleeping with the head at the back. You know, as your skin is repairing and modulating, if you get compressed this side or placing flat on the face, you are hindering the repair and modulation. Skincare is important as well. Some people don't use much skincare, such as myself. I'm a guy. I don't use much skincare. I don't like the sticky feeling. But I do use some serum sometimes, sunblock only when I go to the beach. But in general, please use the right skincare with more growth factors and peptides, maybe exosomes, and please use sunblock, especially when you go out in the sunlight, because the skin is repairing. Please take oral collagen, okay? So collagen has been around in the market for so many years. Take hydrolyzed collagen, because hydrolyzed collagen breaks the collagen down to amino acids. So when you take it in, it gives you the building blocks for your skin to form collagen in the skin, okay? So how do I combine Endymed with the other things in my clinic for optimal results? And I've seen very good results because I combined some of these things. So of course, when the skin is repairing and remodulating, you need your dose of skin boosters, not just any skin booster. Skin boosters with amino acids and HA, not just HA alone. Okay, I won't state any brands here, but please do your due diligence to find out which skin booster has these inside to give them the building blocks. And intravenous amino acid and peptides. Okay, so everyone thinks about vitamin C, IV is not everything. Please use the right IV amino acids and peptides to give your body a systemic pump of amino acids in for the healing. Then, of course, you have collagen banking. So in 2024, instead of depositing money in your bank account and making compounding interest with your money, you need to do it with collagen right now, because the more collagen you put in your skin, the more it compounds, the more it accumulates, you get better repair and modulation after Endymed. Okay, other than that, please do exosome skin boosters is the upcoming trend for better repair and remodulation, and exosome masks after your treatment. All this can be done in the clinic. So I hope everyone can incorporate this for better results. Thank you very much. I come to the end of my talk, where taking selfies without filters. And I hope Endymed and the combinations can give your patients those results. Thank you.
Thank you very much, Dr. Jade, for this insightful presentation. These were truly impressive cases. Thank you so much. We'll just have two short questions. So the first one is, how do you pick between FSR and intensive? If you're like, how do you choose between them according to the indication or the patient that you're having?
It's a very good question, because at the beginning I was very confused. So the intensive is a lot more deeper, because you can control the depth of the needle. So if you're going to go at 5 mm, which is the maximum, yeah, expecting not only 5 mm, because of the RF of the non-insulated needle and the FPM technology, it goes a lot more deeper and wider. So I would use the intensive more. No, in fact, sorry, I will use the intensive. Yes, I'll use the intensive more for stretch marks, for the deeper part, and the FSR, fractional resurfacing handpiece, for the superficial part. Because stretch marks, you need it deep and superficial. But when it comes to scars, it really depends on what kind of scars they have, from acne scars. You have many types of scars. So we know rolling scar is deeper and ice pick scars are deeper. So you need the intensive for that. But for box scars, they're usually quite superficial. You can just use the FSR. But because of scars, they all happen together. It's quite rare to find patient just one type or two types of scars. They usually have all three together. So I'll combine both, but on alternative treatments, not on the same day.
Okay, great, thank you. And the second and the last question is, do you recommend using the mini shaper on the cheeks if we have a chubby face?
Definitely, when it comes to chubby face, don't even think about a small handpiece, because you want to penetrate deeper. Because patients, I mean, somebody coming a bit chubby, they're not going to tell you, I just want to tighten my skin, you know. As a practitioner, you have to know they want the V shape. So you want them to lose some fats and skin tightening. So the small handpiece is just mainly going to give you skin tightening, but this mini shaper can melt some fats with multiple sessions.
Okay, thank you so much, Doctor. And now we are pleased to welcome Dr. Atinuch from Thailand, who holds a master's in anti-aging and regenerative medicine. Today, she will be sharing a small portion of her extensive knowledge and experience with us. So please, Doctor.
Hello, thank you very much. And thank you, Dr. Jade, for your excellent presentation. So I'm going to share my slides now. Okay. Okay, good evening, everybody. I'm Dr. Atinuch Doungkaew from Thailand. And today I'm going to present in the topic of how to treat the acne scar with the combination therapy, which for me, I prefer to use the fractional radiofrequency microneedling combined with the injectable device. Okay. And I'm the board certified for preventive medicine, and I'm also the trainer and speaker for filler thread and biostimulator Untercore, which is the PDO microsphere. Let's talk a little bit about the common skin problem in aesthetic practice, which are enlarged pore, the acne scar, stretch mark, and of course, skin laxity, especially on our face. So actually, we have many ways to treat those problems, such as chemical peel, monopolar radiofrequency, high intensity focused ultrasound, or maybe the YAG1 IPL. We have lots of those. Today, my content will consist of three main content with the type and cause of atrophic acne scar, how to treat those acne scar, and synergistic approach in my practice. Let's start with the type and cause of atrophic acne scar first. Okay. Uh, Acne scar is the permanent complication from acne vulgaris, and atrophic types are the most common type. And the acne scar, it will lead to psychological distress, poor self-esteem, and social isolation. So if we can treat acne scar, it can help our patient to improve both of physical appearance and psychological well-being. How can we get the atrophic acne scar? Is because of after we got the acne vulgaris, it will have many kind of inflammatory mediator, which will lead to enzyme degradation, and it will cause the collagen fiber and subcutaneous fat atrophy, and we will got the atrophic acne scar. We have three main types, which are the box scar, rolling scar, and ice pick scar. The box scar, it has the blood depression with well-defined edge. The rolling, it will have the blood depression with sloping edge. The ice pick, which is the severe type and it is hard to be treated. It has the deep, narrow, which might extend into the dermis layer of the skin. How can we treat the atrophic acne scar? We can use the resurfacing treatment like chemical peel dermabrasion, microneedling, or any kind of ablative laser treatment. Or we can use non-ablative laser like Endymed, DDIO, the picosecond, or erbium. Or we can use the sublative fractional resurfacing like radiofrequency with or without needle. For surgical treatment, we can do the subcision, punch excision, gloving, which surgical treatment it will be best for the ice pick scar. And for injection treatment, we can use also with the hyaluronic acid filler, any kind of injectable biostimulator, autologous fat transfer, the PRP or the cell therapy as well. And these are the diagram that will show you different kind of treatment will affect on different layer of the skin. If we do the dermabrasion or chemical peel, it will affect only the superficial part. With the laser resurfacing, we can treat into the dermis, but anyway, it will have the ablative ablate of the epidermis. So in patients, they will have the longer downtime, or in Asian people, it might cause the PIH. The fractional laser, it will have the thermal zone and non-thermal zone, which the non-thermal zone will help with the skin remodeling. So it will help to fasten the results, and it will have less downtime. In patient with darker skin type, maybe type 3, 4, or 5, after we do the resurfacing laser, it can cause the post-inflammatory hyperpigmentation, which will last more than 4 months, which is the major concern in our Asian skin. And the persistent erythema is common. So for me, I do treatment for atrophic acne scar treatment in dark skin patient is that it should have minimal abrasion, low incidence of PIH, minimal discomfort, because lots of my patients, they don't like to have pain at all. It should have the long-lasting result. So I prefer to use the synergic approach in my practice, because with the synergic way, I can use lower level of the energy setting of the laser. Okay, in my practice, I will use the fractional microneedle radio frequency combined with the injectable one. For today, I will show you with the non-cross-linked hyaluronic acid plus CAHA, calcium hydroxyapatite, and then I will use the cell therapy. For the fractional microneedle radio frequency, which Dr. Jed has presented already, so I will go fast for this part. Why I prefer the fractional microneedle radio frequency? It's because the RF is the color blind, okay? So it don't have the chromophore, no photon absorption. It will provide a deep volumetric thermal heating and minimal disruption of the epidermis. So with the fractional microneedle radio frequency, is it very safe and effective for all skin type? The difference in microneedle RF device, we have to focus on the needle and the radio frequency. What we have to know about the needles, the depth of the needle penetration, numbers of the needle is insulated or not. And of course, we have to choose the high quality of the needle. The sharp needle will cause less pain for our patient. For radio frequency, we have to know that it have the monopolar, bipolar, and multipolar. The machine that we can adjust the fluent and the pulse duration, we can use to treat variety of the problem. So the depth of the needle is very important because at the depth of 0 to 0.5 millimeter, it will focus on the epidermal area. At the depth of 0.5 to 2 millimeter, it will go into the papillodermis. At 2 to 3.5 millimeter, it will go to reticular dermis. 3.5 to 4 millimeter, it will target on the sweat gland and fat. At 4 to 5 millimeter, it will focus on apocrine gland and fat. So with the different depth of the needle, we can treat different problem. About the thermal coagulation, normally, I think we all know that the temperature that higher than 60 degrees Celsius, it will cause the irreversible effect. So the temperature that we want is the temperature about 40 degrees Celsius, which will have the biomodulation and stimulation effect. And energy absorption at the dermis is always more than at the epidermal level. And this is the diagram will show you about the difference of insulated and non-insulated needle. The insulated, the heat will affect only at the tip of the needle, so it will provide narrow radio frequency area. So if you want to treat different level different problem, you have to use multiple parts with different depth, and it have a risk of bleeding. For non-insulated needle, the heat will perform over the whole length of the needle, so it will have wider radio frequency area, so less part will be needed and less bleeding. And monopolar, bipolar, and multipolar, just like Dr. Jed already told you, the deeper one will be the monopolar RF, which will require the cooling device. But the multipolar, it will have the more superficial penetration, so no cooling is required because it won't have too much pain for that. The Endymed low intensive, it has the fractional microneedling radio frequency, which it have motorized dynamic needle insertion. So when we use this machine, the needle will insert into your skin very smooth. It don't have any stamped effect, so our patient will feel more comfort. And we can adjust the depth of the needle penetration up to 5 millimeter. And the intensive technology, the needle, it is very sharp. It has the gold-plated with taper needle. It is a non-insulated with 25 micro diameter needle. And with the flow, it can penetrate depth up to 5 millimeter. And the radio frequency, it is the 3 deep RF technology with maximum power at 25 and the power duration maximum at 200 with the fractional power mode. The fractional pulmos it designed to deliver the energy in micro pattern like this, so it will provide more uniform distribution of the energy. So it have a wider range of the radio frequency from this device. This is the difference of the other non-insulated RF needle and our Endymed FPM technology. So it can provide wider range of radio frequency. And this is the suggested parameter from the company, okay? So the advantage of the fractional microneedle radio frequency is that it can help with fibroblast proliferation. It can help to increase the dermal collagen production with minimal pain, less downtime, and it's very safe for dark skin type. So next, I will talk about the non-cross-linked hyaluronic acid plus CAHA. The one that I talk about is the Nivea Hydro Deluxe, which has the main ingredient with the non-cross-linked HA at 18 milligram per cc, and it have the CAHA 0.01% and glycine with alpurine with the amino acid. The property of hyaluronic acid is that it has the ROS scavenging effect, so it can help to reduce inflammation. It can help with moisturizing effect. It can help to reduce the transepidermal water loss, and it has anti-inflammatory effect. For the non-cross-link, it will be safer than cross-link HA because the non-cross-link, it will have less vascular occlusion risks. About the CAHA, it will act as the scaffold, so it will help the skin to produce better ECM, extracellular matrix, and it will lead to more collagen and elastin production. About the cell therapy, I use the exosome, which is the non-living single membrane nanocyte extracellular vesicle, and inside the exosome, it will have the lipids, protein, the nucleic acid, and non-coding RNA. Why I love the exosome? Let's talk a little bit about the molecular mechanism of skin aging, which is the cellular senescence. The aging cell, especially on the skin, it comes from the telomere shortening, the oxidative stress that is too much, and the inflammation from the cytokine. From those RF, it will activate the MAPK pathway. So it will induce the degradation of the collagen and elastin. So it will lead to wrinkle and sagging. So the exosome will help with those cellular senescence because it has the regenerative effect. How can exosome have the regenerative effect? Because the exosome will have the angiogenic ability. It can help to increase the vascular formation around the area that we treat. It can help to increase the collagen production, and of course, it will be very good for reduce or regulation of any inflammation. In my practice for acne scar and pore, I will use the fractional microneedle radio frequency, which I use the Endymed intensive. The fluent and the space, it depends on the skin type. Normally, I will do it 3 to 5 sessions, depend on severity with 4 to 6 week interval. Then I will use the non-cross-link HA plus CAHA at dose 2.5 to 5 cc per session, depend on severity also, at 3 to 5 sessions with 4 to 6 week interval. For injection, I will use the sandwich technique or combined technique with the blunt cannula to do some subcision and place the material at intradermal or subdermal plane. And then I will use the sharp needle with NAPAC technique into the superficial intradermal area. And then I will use the exosome, 1 vial per session. I will apply and occlude for 15 to 20 minutes after doing the whole procedure to help to reduce the redness or any sign of inflammation. And this is the protocol to do the Endymed intensive. First, we have to clean the patient's skin and apply the EMLA or the numbing cream for 30 or 40 minutes. And then we do the test spot of the intensive, especially in patients that do the treatment for the first time. And then we wait for 5 minutes. And if you notice that the patient's skin is not too red, it means that you can use that parameter and you can continue the treatment. After that, you apply the moisturizing cream. Okay, and this is the testimonial in the first case for me. She is a Thai female at 27 years old. Look at her. She has a little bit downturn of the eye corner, and she also have the mid-face volume loss with the periorbital hallowing. She start to have the stacking of nasolabial fat, the jaw fat, and submental fat. For her skin quality, she has a large pore and mild depression of the acne scar with some freckle. So my treatment plan for her is that for mid-face volume loss and periorbital hallowing, I will do the hyaluronic acid filler injection for her. For the downturn eye corner and the sagging of nasolabial fat, jaw fat, and submental fat, I will use the high G prime hyaluronic acid filler to do some lifting, and then I use the fractional microneedle radiofrequency to improve the collagen and elastin to help her skin to tightening up. For her skin quality, like a large pore and acne scar, I will use combination treatment of fractional microneedle radiofrequency, non-cross-linked hyaluronic acid plus carha, and exosome. This is the protocol to treat the sagging face for her or for lots of my patients. I will use the mobile ultrasound to assess the skin thickness first, and then I will choose the depth of the needle depends on the thickness of my patient's skin. At the first part, I will do focus on the lower face and lateral side of face because the area here have a thick layer of the smash. So in the area here, normally my patient will have about the needle at the depth of 3 to 4.5 millimeter with energy at 12 to 14 watt, 110 millisieverts. At the second part, I will focus on cheek, nasolabial fold, and jaw fat. At the depth of 2 to 3.5 millimeter, at the energy of 12 to 14 watt, 110 millisieverts. Then I will do the third part at the periorbital area, forehead, and perioral. This area, I will use the needle depth at 1.5 to 2 millimeter, 10 watt, and 80 millisieverts. The red one is the precaution area because in the patient with nasal implant augmentation, I might skip this part or do it at only the alar area. And in patient with serious sagging, normally I will do more vector treatment to lift her skin up. And in patient with acne scar, I will do additional application on the affected area. And this is the video demonstration. First, put on the numbing cream and use the plastic wrap occlude for 30 or 40 minutes. Then I will do the ultrasound. Normally, at the dermal and epidermal area, the patient will have about 1 to 2 millimeter depth. But for the SMAT, normally she will have about 3 to 4.5. And this is the Endymed Pro, which we can use the maximum energy at 25 and maximum depth at 5 millimeter. Then I will perform at the lower and lateral side of the face first. During the treatment, I will use my non-dominant hand to stretch the skin to make sure that the needle will insert deep into the skin properly. And at the cheek and nasolabial area, I will adjust the depth of the energy. In this patient, at the cheek and nasolabial area, I used at the depth of 3 millimeter. In some area, I might pinching the skin a little bit. And then I will treat the periorbital area. My non-dominant hand will pull the skin up because I want to do the laser on the area with the bone, which she have bony support. You can see that for this machine, it had very, very minimal breathing. And I will add the additional part on the concern area like the paw. This is the picture before and immediate after. You will see some swelling and erythema. Then I will start to inject the Nivea Hydro Deluxe. Since she don't have too much atrophic acne scar, so in this case, I use only sharp needle with the nut part to the intradermal area. You can do it all over her face. And then I will apply the exosome to reduce the inflammation and the redness on her skin. I use the ASC exosome, which is the exosome from rod stem cell. After apply whole area, then I will mask with the sterile mask and occlude for 15 minutes. Okay, so that's finished for this case. This is the parameter that I use in this case. In the first part, I use the depth at 4 millimeter, 14 watt, and 110 millisec. At second part, I do with at the depth 3 millimeter, 12 to 14 watt, 110 milliseconds. And at the third part, I do with the depth of 1.5 millimeter, 10 watt and 80 milliseconds. And this is the result before, immediate after, and 15 minutes after apply the exosome. So you can see that after apply the exosome, her redness and swelling has already much better than before because the exosome, it have the anti-inflammation effect. And this is the picture from the 3D meta view. At normal life, 5 days after Endymed with exosome marks, we can notice only the microclust and it has really minimal downtime. But anyway, from the polarized light, you will see some redness there, but with our eye, we cannot see. This is the picture at before and 1 month after. You can notice that her sagging problem at nasolabial fall nasolabial fold and the jaw has been lifted and her face looks slimmer and also her skin more glow and smoother. At this oblique view, you can see that her jaw fat has been lifted up already. This is the result after only one single treatment of the Endymed intensive. You can see the beautiful result, especially on her skin texture. This is the result before and 1 month after. Her freckle, her pigmentation has been improved already, and also with her skin has more glowy and smoother. This is the so I will present the next case. This case, she has problem with the enlarged pore, the atrophic acne scar, and the melasma, and she has been treated with picosecond laser for about 10 times already, and she has the problem of the dryness of the skin and very sensitive skin. In this patient, I treat her with the first part at the depth of 4.5 millimeter, 14 watt and 110 millisecond. Second part, I use the depth of the needle at 3 millimeter, also 12 watt and 110 millisecond. The third part at the periorbital area and forehead area, I use the depth of the needle at 2 millimeter, 10 watt and 80 milliseconds. And I do additional part on her problem area with the depth of the needle at 3 millimeter, 12 watt and 110 milliseconds. And then I do the injection of Nivea Hydro Deluxe ASC exosome, and I give her the topical cream, which are the Isis Neotone that help to reduce the pigmentation, and the Isis Thin Derm that help to reduce her acne problem. In this patient, I do 2 treatments with 1 month interval, and this is the result 2 months after treatment. You can see that her skin texture has been much more better, as well as her melasma already improved. And this is the same patient on the polarized lines. You can see that before she had lots and lots of the redness because she had inflammation under her skin. And after treatment with this protocol, after doing the Nivea Hydro Deluxe exosome and intensive, her inflammation, her redness has been better. It's still there, but much more better than before. And at the second time, she said that when I put on the numbing cream, she don't feel any tingling sensation or burning sensation at all. For my conclusion, why I prefer the Endymed Pro Intensive, because Endymed Pro Intensive have high quality needle, and with the radio frequency that have the FPM mode and 3D technology, it will deliver the wider range of the radio frequency. And it have multifunction in one machine, like Dr. Jed has already present you. So in only one machine, you can treat whole body. So it is very unique, and it is very good machine that one machine can treat all problem for your patient. Thank you very much. That I finished my presentation now.
Well, thank you so much, Doctor. There's no doubt that one of Endymed's key advantages is providing a platform with excellent potential for combinations with other products and technologies, as Dr. Atinuch showed. So thank you so much for this very informative and professional presentation. We have just a few questions for you. So the first one is, what type of exosomes do you use, like human exosomes or synthetic exosomes?
Actually, I have used both of them, but anyway, in Thailand, only the vegan is approved. So we have only the rose exosome. But anyway, if you have used the SC exosome, they have the study that show you that there is no the rose exosome can work very well compared to the adipose tissue exosome. So when I use the rose exosome, it can deliver the good result as well.
Great. The second question is, how do you combine the intensive with the hyaluronic acid, the KAHA, and the exosomes? Do you do both of the treatments at the same session or different sessions?
Yes, I do them all in one session. I will start with the Endymed intensive first. Then I will use the Nivea Hydrodilac injection. And then I will use the exosome apply and occlude. And then my patient can go back home.
Great. Another question is, it's regarding the non-insulated needles. Did you have any situation of hyperpigmentation while using the non-insulated needles of the intensive?
Because the FPM technology from the Endymed. So there is no it have uniform deliver of the radio frequency. So after I use the Endymed Glow Intensive, I never experienced with any hyperpigmentation. But anyway, I haven't used the other non-insulated needle. I'm not sure. How about your experience, Dr. Jed?
Yeah, so great to hear that you did the experience. And yeah, this is something that we promise our clients, that they wouldn't have this kind of problems. And now another question is,
I don't
in
I
what
don't get PIH as well. Yeah.
Yep.
With the Endymed intensive, I don't get any PIH in my patients.
Great to hear. And you doctors are treating like very various like types of skin colors. So, and also you're using different range of power and pulse width. So that's very promising what you're saying, that we don't have encountered this kind of problems. Another question is, in what situations do you choose a KAHA in treating acne scars?
Actually, both case that I show you, I use the KAHA in both case. For me now, in the patient with acne scar or any patient that they want to do the rejuvenation or the biostimulation of their face, I will always combine with the injectable of Nivea Hydrodilax, almost every case. Yes.
Okay, great. And the last one is what kind of injection you have? And they're asking about the first case. Okay, what kind of injection you
case
have
one.
and what effect it gives. So you already, yeah.
Yes, in case one, yes, I use the Nivea Hydrodilax. It gives the hydration effect. It can help to tightening the pore. With the KAHA, it can stimulate the collagen stimulation. And for Nivea Hydrodilax, lots of my patients, they report that their pigmentation will be improved also.
Okay, and regarding the number of passes and number of pulses with the intensive.
For case one, right? Per one area, I do two parts. The first part is the area that I told you that on the lateral side, I use the depth of the needle at 4.5 and then 3. And then I do the vector lifting for her in this case. So altogether, I do only two parts. And how many pulse? How many pulse? Per
Pulses.
pulse?
Yeah.
Pulses.
Like shots with the intensive.
Oh, how
Like,
many shots?
yeah.
Sorry.
It's
Roughly
hard to
per
remember.
phase, per one treatment. Roughly per case in one treatment. I will use whole face about 300 to 400 pounds per one face.
Great. Okay, so thank you so much, Dr. Atinuch, Dr. Jed. Thank you so much. It was very interesting for me personally. I had a great time hearing you, and I suppose our participants also. So thank you all. Wishing you a great day or great evening. And please stay tuned for our next webinar. Details will be shared soon. And all of the recording and materials that we have shared today, we're going to send it to you as well. So thanks again, and goodbye.
Thank you.
Thank you. Thank you.
Dr. Atinuch. Thank you, Asra.
Bye bye.
Bye-bye.
Thank you, doctors.